Affordable access to care for all Texans. Wikipedia defines social equality as a state of affairs in which all people within a specific society or isolated group have the same status in certain respects, including civil rights, freedom of speech, property rights, and equal access to certain social goods and services. My topic of choice for this assignment would be the social goods and services that are associated with access to health care in the United States, and more specifically to the state of Texas. In the United States, where our health care is privatized, there is a division among the population of those who can and cannot access health care through insurance. According to Wright and Perry, health care is not a basic human right. It is a commodity that can be purchased through private insurance companies, or that is sometimes provided through an employer. The way healthcare is organized in the United States contributes to health inequalities based on gender, socioeconomic status, and race and ethnicity. Let's take a look at this infographic. Here we see that the Commonwealth Fund has produced a slide in March of 2017 that shows the uninsured rate in the nation's 4 largest states. 7% of those adults who are aged 19 to 64 who live in New York are currently uninsured. 10% in California, 16% in the state of Florida, but 25% in my state of Texas. Why? Why are so many Texans without health care or access to insurance? Well, as it turns out, the population that doesn't have health insurance coverage in Texas includes people from a range of backgrounds. Most uninsured Texan adults are low-income workers. Nearly 70% of uninsured adults are in a working family. 40% live below the poverty level. Uninsured adults in the state are also, on average, younger and more likely to be people of color than those who have insurance. In addition, 20% of uninsured adults in Texas are undocumented immigrants. Those are the folks who remain outside the reach of many of the provisions of the Affordable Care Act. So what can we do about it? Well, in order to ensure more Texans have access to adequate and affordable health care, the first step for all of us is to become consumers and advocates for ourselves. Let's shop around. Look for a policy that will provide adequate coverage based on your individual or family needs. There's a statistic floating around out there that suggests 90% of all health benefit decisions or health insurance decisions are made by the female member of the family in less than 15 minutes. What else can we do? We can educate consumers. Educating them using simple, straightforward language, visually highlighting the plan's products and services, creating platforms or apps that helps consumers to make the right choices based on their circumstances, and utilizing our benefits with quality, outcomes, and cost in mind. It's also important for us to educate providers and facilities. When was the last time you went to your PCP and he or she could tell you the cost of the visit? How about a provider that knows the cost of the MRI that they just prescribed to you? Did you know that it could be hundreds or even thousands of dollars less if you choose the one that is a freestanding MRI and just 2 miles further away than the in-hospital machine? Educating providers and their teams on the ins and outs of affordable options for treatments and care should become standard. When we all prioritize the value of care over the quantity of care, that is, we help providers understand that it's not as important to treat them and street them as it is to treat them knowing they won't come back, we'll see that prices will become more competitive. Insurance plans will become more cost effective, outcomes will be better, and more people will be able to afford health insurance. I would be remiss if I didn't consider universal health care. Lots of developed nations have universal health care. And sure, that would help Texas reduce the prevalence of those who are uninsured,